Good afternoon, and thank you for joining Supporting Staff During COVID-19. My name is Laura Michoud, and I'm the Executive Director of the Supportive Housing Network of New York. For those of you who may be unfamiliar with us, we are a membership and advocacy organization promoting the development of supportive housing as the answer to homelessness for individuals with behavioral health needs and other vulnerable populations. In lieu of our annual in-person conference, the network is hosting a series of online panels to help us move through and beyond COVID-19 and reflect on our policies and structures that support structural racism to help us emerge stronger and more equitable as a community. Next week, our panel on crisis response will be moderated by public advocate Jumaane Williams to envision a more effective and just crisis response model for New York. Please see our website for a full lineup and register. A special thank you to our sponsors and a huge shout out to our team, specifically Emily Levine, Joelle Balam-Schwam, and Cynthia Stewart for creating this panel today. Housekeeping, we will reserve time at the end for Q&A. Please submit your questions in the Q&A box. The panel will be recorded and posted on our website. Lastly, thank you to Jeannette Ruffins, who is moderating our panel today, and to our amazing panelists for sharing their thoughts and actions on this incredibly important topic.
Welcome. I see we have 165 people participating today. So this is really, really exciting. So listen, Thomas Paine said, these are the times that try a man's soul. And this is definitely the times that have tried our souls. But, to be honest, the past 7 months, nonprofits have really had to step up and change the way in which we do business to support our staff and to maintain the high quality of services that we are known for. So I want to thank everybody for joining us today. And because an hour is really not that much time, I'm going to jump right into the panel. So let me introduce my panelists. Adina Barbosa, Deputy Chief Program Officer at CUCS. Raihana Bosse, from Program Director from Henry Street Settlement. Mark Jennings, Associate Executive Director at Project Fine, and Fred Schack, CEO of Urban Pathways. And so what we're going to be talking about today is kind of the ways in which we had to adapt and change, and ways in which we, specifically the ways in which we supported our staff through this epidemic, and some of the issues that came up around structural racism. And so I'm going to start with Fred Schack and talk about what was the most critical thing you did. What is the most critical thing you think you did to start addressing this during the pandemic?
So thank you, Jeannette. That's a rather difficult question. I'd say that the most important thing that we did was to really sort of manage the messaging and the communication. And that really started with recognizing who our staff were and what some of the challenges were going to be for both our clients and our staff. And I'd like to approach this from a social and racial justice lens. So who are the staff that we're talking about supporting? And for Urban Pathways, it's our outreach workers, our maintenance staff, our food service staff, our front desk staff, our administrative assistants, the case managers, the nurses, the case manager supervisors, program directors, and the directors of social services, all of whom were not able to work remotely and perform the essential duties of their job. So these are individuals who, throughout the pandemic, needed to be available to do outreach, to connect with clients who are living on the street, and or provide services in our residential building. The other thing that's sort of the common denominator here is that most of these people, if not all, are people of color, women, and Black and brown individuals. They are historically been grossly underpaid and undersupported. So one of the things that we wanted to do first and foremost was to address the things that I thought was most essential. When I learned of the pandemic, my first question is, am I safe? Is my family going to be safe? And our job as an organization, the reality is I couldn't expect them to be available for our clients if I wasn't able to provide them with some sense of certainty or at least give them some information that would help them sort of address that question. So we really focused our energy on getting as much information as possible, as quickly as possible, and disseminating that information to our staff as quickly as possible as well. So what did that mean? That meant going through the number of notifications we were getting from the Department of Health, from the Department of Social Services, from the state, from the Department of Health and Mental Hygiene. I mean, every city, state, and federal agency, the CDC, was bombarding us with information. So we had to be able to go through that information to identify the elements that were sort of sort of associated with what we were doing, and then to decipher it in such a way and get that information back out to our staff as quickly as possible. Initially, we were able to do that through email notification. So we put together a policy statement, first and foremost, for people who at the very beginning of the epidemic were concerned about their personal safety. You know, the expectation could not be that you have to show up at work. So we basically said, look, guys, if you are not comfortable coming to work, it's okay. There are enough of us who can sort of step up and take that responsibility for you during the interim while you sort it out. So if that meant you took vacation time or sick time or personal time, whatever time you had, you could just go ahead and take it. We were fine with that. We could manage through that. Most of our staff, I'd say the large majority of them, were showing up every day because that's who they are. So then the question was, okay, what do I need to do to make sure that you're going to be able to manage this pandemic in a way that will give you some level of comfort? So getting PPEs as quickly and as effectively as possible, making sure that every employee for every shift that they were working had PPEs. Dealing with the density issue, getting in very early and determining that we don't need to have the full array of staff at all times. And quite frankly, doing that also compromises their safety. So coming up with a model that provided people with the ability to work remotely part of the time, those individuals could do that, and reducing the total number of people on site at any given time. We began having daily meetings of our senior staff where we would review the information, put together the messaging, get that information out to our staff as quickly as possible. We also went through a process of beginning to do full staff briefings. So we used Zoom. We bought laptops and Zoom licenses and began hosting all staff Zoom meetings every 2 weeks. And that was an opportunity for me to talk directly to our employees and for them to get back to me very directly around what are some of the things that they were sort of struggling with on site in order to manage some of the anxiety and also to address some of their concerns.
Adina, when we were talking earlier, you had spoke about how you structured supervision during this time to make sure that your staff on all levels and then down to the residents were. Can you talk a little bit about how you did that?
Yeah, sure. Thanks. First, I just want to say thank you to all the CUCS direct service staff at our program sites for being so resilient and flexible and doing such amazing work during this unprecedented time with all the issues with COVID and all the racial justice issues going on. So thank you to them. So yeah, I want to talk about the stuff we did then to support them in all this work that they're doing. So it was important for us, similar to what Fred was saying, to have support at all these levels. So our executive team, again, at the beginning of COVID, met daily to talk about, what was going on, what needed to happen. And then that trickled down to my level of the deputy chief program officers and our QA director in terms of sort of figuring out what has to happen on the ground, sort of what are the policies and procedures, and then rolling that out very quickly with our staff. Because it was important for us to have clear and regular communication at all levels and really have clear policies and procedures. So people didn't feel like they were on the ground, reinventing this themselves. So there was support at all the levels, and being transparent with people that we were in flux and that we were communicating and giving guidance when they changed. In terms of the supervision, we broke our program staff down into 3 teams. So it would be everyone did 1 week on, 2 weeks off. So really, bridging that gap between the on-site staff and the off-site staff. We were doing daily check-ins every day and at the program level and check-outs. And so that was a few reasons. One, making sure people were like updated on all the policies and procedures and things that were rolling out and all the changes that were happening, sort of coordinating what was getting done on site, what was getting done off site, who was doing what, and then also the support for the staff. This was not only impacting them on their professional level, but on their personal level as well, and creating a space for them to be able to talk about that and what it was like for them dealing with COVID, not only maybe in the workplace, but also at home. So we did things like that. And then, you know, just creating a lot of really clear policies about like the telecommuting, supporting staff in setting up their Google Voice numbers so they're not giving their cell phone numbers out to the clients, the Zoom accounts, the conference call numbers, really clear policies about when to meet face-to-face with clients and what was an essential thing to meet face-to-face and how you could do other things remotely, adjusting our policies related to medication monitoring. The PPE was really big as well. Also at the beginning, supporting our staff when clients or staff were presumed positive at the beginning, and supporting staff when we did have a tenant at one of our buildings die early on in the pandemic in March, and sort of not being able to memorialize them in the way we would, and being able to support them in the individual supervision as well as in the staff and team meetings with that. And before the city did the contact tracing, we sort of developed our own internal thing in a policy and procedure with our medical staff. So people were feeling, they all knew what was going on in the program, who needed to quarantine, why, who was taking like exposure quarantine measures. So talking about that in supervision on the team, having everyone in the building be on the same page was really helpful. And one of the things that was, I think our staff, and I know myself, found really valuable and other people were really positive. We have a chief medical officer who would sort of send out these really relatable and digestible things about COVID. And so sort of explaining it in ways that like was relatable and made sense. Like people told me they even shared it with their family and friends. So at the beginning, it was like, you know, every few days when there was a lot changing, but that still continues. So then it was like weekly or now monthly, like we just got one yesterday. And I actually look forward, and it's very sort of supportive and calming to like read those and see what was going, you know, how he breaks it down.
Yeah. Thank you. So just a reminder, in addition to the questions and answers, if people are seeing things or hearing things that really resonate with them, please put a comment in the chat. And I want to go to Raihana to talk a little bit more and start the conversation about very specific ways in which we supported staff during this pandemic.
Thank you, Jeannette. First, I'd like to say thank you for having me today. So a lot of the ways that we supported, we had to pivot really quickly, right? So pandemic, we had no context. No one had ever lived through this before. And so a lot of the things that we did was flexibility around scheduling. A lot of our staff, you know, have staggered schedules now because we wanted to allow for them to be able to travel safely during the early parts of not only just the pandemic, but a lot of the racial unrest that we were still living in. We had curfews, and so we had to change schedules so that people could get back into their, you know, back home safely, and had to commute through those riots at times. And so to allow for that safe travel, we changed some of the scheduling for staff to come in. So we had a lot of flexibility around that. There were paid differentials that we offered, as well as childcare stipends for those of us who were impacted because the schools were now closed and childcare providers were no longer, you know, available. So for those to have individuals watch their children while they could and would want to come to work, we provided that. A lot of the things we did too, providing lunch, because again, things were closed. You couldn't just go out and get lunch as you normally did. So having lunch brought in for the staff, also sort of a morale boost, because you're working through this pandemic. You're also living through it, right? So historically, as service providers, we're there to be that grounding force for our families that we're trying to support, because they're in crisis, but now we're all in the same crisis and going through it together. And so providing those little things to kind of stabilize, you know, everyone. I know for me specifically, when I did supervisions, like Adina spoke about with my team, my direct reports, and then the larger team, having a space to kind of just check in on people's mental wellness, right? How are you feeling today? How are you, we expect people to come to work and be present, but what's going on with you and how is that impacting the work? And so giving a space for them to be able to just sit and reflect and figure out how they're feeling about what's going on and how they can continue to be a support to, you know, the families that we serve. And it's just overall just trying to keep each other safe and being a sounding board for each other, because sometimes just that peer-to-peer contact is what you need, just to have someone to process your day as you're going through your day, and just someone to lean on, and providing that. As a larger organization, we had more meetings in terms of large scale, the same way Adina's organization did, where we were having more forums for everyone to come together and get information and synthesize the information that was coming from, left and right from all entities, and really understanding what we were dealing with and how to process that, and then feed that information to the individuals that we're serving to help to stabilize them as well. So we really had to have a all hands on deck approach, but and we still continue to do so, and just trying to move through this pandemic.
So, as we all move to digital platforms, I think there is a huge digital divide. And I think as we started to address the digital divide for our residents and clients, we were faced with kind of also having a digital divide with our staff. Did anybody, can anybody talk about ways in which they had to address that, or how they addressed that?
Well, we worked with our staff to get laptops to them, and those individuals who did not have Wi-Fi access at home, we made arrangements to give them the MiFi so that they could still communicate with us. I think the larger challenge for us was really making sure that our buildings were properly wired, because it's one thing to have a case manager work remotely, but if you can't remote in and have a conversation with your client, then you've got to be physically there. So we needed to create a method of making sure that our clients also had access to the technology to enable them to be able to communicate with their workers remotely.
And we also had to increase, give people a tech stipend, right? Because not just were people found themselves working from home, those who could work from home, but they were also at home with their children, with maybe their partner also trying to remote in, and a lot of people did not have enough bandwidth really to have everybody online all together. So that was one of the things that we kind of did a tech survey to determine that. Did anybody else, were there any other kind of unique stipends or ways in which you financially supported people? I know that many of us across the sector did kind of a pay differential for people who had to come on site, but what were some of the other incentives or things we were able to help pay for?
And I don't have to add to that, but did want to add just one thing that we did do was have our board members give calls to the staff, and our executive staff give calls out to the staff, and we split up the list so that people can call, so that we can have our board involved, because they were on our weekly meetings, and we're trying to figure out ways that they could be involved. And so that was just another element that we added here.
I see somebody posted that they did phone stipends, like to help pay for people's phone bills. So that was good. Did anybody else do anything kind of in a group setting for mental health? I know we talked about specifically in supervision, kind of the check-in, but were there any wellness programs that people heard about or did themselves?
So we increased access to our employee assistance program and really encouraged our staff to utilize it with the understanding that if necessary, we were willing to pay for additional sessions, especially because people were experiencing loss, within their community, within their family, and trying to manage that, and also managing working at the same time. So really focusing on the fact that you can't be there for the clients if you don't take care of yourself. And our obligation is to provide you with as much support as possible to enable you to do that.
Yeah, we also increased our EAP allowance for the staff, but also created a helpline where individuals can call in and speak to a licensed social worker and kind of get some additional support. And that was not only just for staff, but also for a lot of the residents in the community, because we do service the Lower East Side. And so they had that ability to have a pipeline to reach out and have someone to speak to get us some additional guidance and support.
I see in the chat, somebody said they were doing kind of remote yoga comedy breaks, and that they had workshops on compassion fatigue, which honestly, I think we all kind of needed. So those are great ideas. Thank you, whoever posted that. Yeah, man, I do think that, which is probably always true for us. I mean, you know, in the helping professions that we talked about burnout, but I do think that this was particularly stressful as people try to navigate their own lives. And then we did have a lot of death and loss and stress, and really kind of expecting people to show up every day and really having to have a focus on that ourselves. And it really, I think we did a pretty good job. I'd be interested if anybody else wants to post. We are keeping all of these posts so we can get back to that. I see somebody else just said morning meditations. Yeah, we did meditation. That was true. Wasn't it? All right, so the other thing that we went through this at a time, obviously after George Floyd, there was a huge upswell of recognition of injustice and racial justice and social injustice and social inequity. And so I think as we were trying to do this at the same time that people were locked down, burnt out, and angry, you know, both in their personal life and their work life. As Fred started out, we are predominantly, our staff are persons of color. We serve predominantly persons of color. And so I just wanted to ask Mark to start the conversation on maybe some of the ways that, some of the challenges we had and some of the ways that we started to address that.
Thank you. And so, and again, like everyone else said, I want to thank Shinny and just want to thank you, Jeannette, and everyone for hosting this. You know, here, I think for me, I was looking at people not getting paid a lot of money and risking their lives to save lives. And that was, and that's the kind of work we do. And it's always not as a rewarding job in many ways, just in general. And so during this time, trying to figure out how can I support people? And for me, I ended up putting together what I called a virtual refueling series. And that was just essentially calling friends of mine. So that was Brandon Lloyd, who won Shark Tank, and Chef Rock, who won Hell's Kitchen. And we had a nationally recognized DJ who did a party for us. And, you know, a person that does yoga, sort of neo-soul and yoga, and some authors who are nationally recognized, and just called them and said, hey, I want to do something to support the essential workers in supportive housing here at Project Find. Will you help me? They said yes. And intentionally, we put it during the week of 2 weeks in June with the end date of Juneteenth, because obviously as COVID and you know, sort of the nation kind of swelling around racial inequity, I wanted to be able to incorporate both, and that was very intentional in our process. But I also wanted to let people know more about us. We knew we might need donations, and so to make this open to as many people as possible, even throughout the country. And we were very successful in that. And we looked at, we started out, it was really about mind, body, and soul. So we talked about death as the first session, because people were having family members die, and not just people you work with, but in your family. We, again, those Zumba and other things, looking at kinetic, being able to move, thinking about, I mean, we had a thing on the history of Black chefs in the White House. So sort of thinking about the mental aspect of things, because not everybody wants to do yoga, but a lot of people like to do that. And we also tried to incentivize it, so that I wanted to give people Juneteenth off, but that was new and controversial. So one of the ways that I was able to get around that was to give, if you came to one event, you were given a day off. If you wanted to use that for Juneteenth, that was great, but you also had the option to use it or bank it or use it at some other time. And we also incentivized people coming by giving them a $100 Amazon gift card. We did raffles for each event as well, and that was a way to kind of just pull people in. And lastly, I held those events at 7 p.m. Because I recognized that there was no real time in the day where there was inequity in that. Some people could sit and have lunch, and some people are at desk and don't have computers or can't participate. And so I wanted to be able to think about that as well. So, you know, and I was proud of it, and people are still talking about when are we doing the next one, and I just knew how much work went into that, and I said maybe next year.
So did anyone else do anything in particular? Well, one, I think we all started to kind of look at racial justice and inequity within our own agencies, but anything that you want to share with the group?
So we started a anti-Black racism work group within the organization. We didn't post a organizational statement because, quite frankly, was more interested in developing an action plan that could really speak to things that we could do within the organization in order to make sure that Urban Pathways is an anti-racist organization. And we had some work to do there before we could go out and make public statements. But I think the other thing I wanted to say is that, you know, part of this process of supporting staff is trying to figure out whether or not it's working. And the way we determine that is by asking our staff, getting feedback directly from them. And very honestly, the two things that they felt, well, actually three things. I think they really appreciated the fact that we committed early on to ensuring that everyone had a personal protective equipment for every shift that they worked. And that without fail, we were going to make that happen. I think they appreciated the fact that for a period of time, we provided them with a $15 seamless stipend so that they could purchase meals for every shift that they worked. But the most powerful thing was the fact that we paid time and a half for every employee that worked on site from March until, I think it's going to end on the 17th of this month. And that was really, really, really appreciated by our staff, because other than, you know, telling they're essential employees, applauding at 7 o'clock at night, the reality is that we know who they are. We know that they are making major sacrifices to come in. So the best way of saying thank you for being who you are and doing what you do was to put money in their pockets and help them to be able to take care of their families.
Yeah, we did the pay incentive as well, but for our staff that were reporting on site. And I mean, it was amazing. Before we did that, all our staff were still showing up, which is just
exactly.
Yeah.
So it was good to be able to, you know, so they were motivated, self-motivated, but it was good to be able to provide that incentive for people that were doing that. And internally, we have a committee on diversity, inclusion, and belonging that is very diverse across all programs, all different levels of staff, all different backgrounds of staff, that was, you know, doing a lot of work and focusing on developing a mentoring program, looking at our hiring and moving people on prior to COVID. And unfortunately, COVID happened and sort of stopped. And then the issues came to, you know, to a head again, and we really restarted that committee and really are, you know, are on a track with that as well. And it came up from our staff and getting feedback about Juneteenth. And then we recognized Juneteenth and gave our staff Juneteenth off as a day of like reflection as well.
Yeah, we've actually made it a agency holiday in lieu of Columbus Day starting next year. So it's sort of baked in. That was one of the low-hanging fruit, the things that we could do very early on.
Yeah, we did the same thing, recognizing Juneteenth as a holiday now, and now we have a racial day of healing for those who cannot take the day off because of the operation of the, you know, our facility. You can use that day throughout the year, but recognizing that day, we have a DEI committee that's been really rampant and working hard. And because of COVID, other committees have popped up, health and wellness committees, retention committees. So there's a lot going on now to ensuring that people are feeling supported and having the supports they need, and also having the space to have their voices heard and what because before, you know, a lot of the times you didn't feel like you had a say in what was going on in the policies that were being made. And so now everyone has that opportunity to be present and have their voices heard and have some changes being made.
How do you ensure that, like, participation in all of these committees is like across the whole agency? Is anybody, any ideas on that because oftentimes, you know, like they say, people who volunteer for things are already in a particular headspace, and you want to make sure it's representative.
I know myself, I kind of look for that talent that sometimes is the quiet talent and may not automatically join, and kind of have a conversation with them and nominate individuals. I mean, it's never forced, but speaking to their strengths and what they could bring, you know, outside of what I see to bring into the larger community. But I think too, because of this pandemic, it kind of broke down a lot of those lines that you naturally kind of feel exist within an organization. And so you're having more communication with the CEO, with the VPs, you know, that stuff kind of started happening organically. And so people also felt more empowered to reach out and say, like, I do want to join this committee, where before they probably would have stayed in the background.
Yeah, I think we put out like a few questions for people to think about on why they would want to be a part of the committee, how they identify, to have some diversity, and also it not just also coming from who the program director thinks is the person for it, but really helping people. I mean, encouraging people, but helping them to identify. And when you have a committee like that, that's run by like, and there's senior people on it, what we did at the beginning is we had an outside consultant come in and do a full day retreat for the committee to really build those relationships and trust within the committee. So then moving forward with the work, they had that framework, which was really helpful for the committee as well.
Yeah, and I just wanted to add, I mean, in my case, I didn't have the opportunity and luxury of having a committee, but we pushed a lot of that on making sure that was on the executive staff. But we did surveys, and then because we wanted to make sure to get the voice, and we walked around. And before we did, like even before the virtual series, there was a survey. Would you like to see something? What kind of things would you be interested in, so that we could make sure that the voice was still heard from all levels of the agency?
Yeah, and even before COVID, we have a digital suggestion box, which is really designed to encourage staff to communicate directly with senior management. As those items come in the box, we review them as part of the senior management team meetings, and then we prepare responses back to the employee if they identify themselves that they are anonymous, and we publish a employee newsletter where we post the question and the response there, but really trying to encourage an open dialogue. It's difficult to do in a large agency. We have like 400 employees, but we really do encourage people to give us suggestions, give us feedback, raise questions, with the commitment that we will review them and we will provide a response to them. We also do biannually, we do a employee survey where we solicit feedback from the staff of the organization with the intent to use that information to change policies and procedures. So, you know, we have a casual Friday, we have a tuition program, we have early release during the summer. I mean, almost all of those things came as a result of either the suggestion box or the biannual staff surveys, asking them for their input.
Fred, somebody just posted and asked if you could talk a little bit about your virtual digital suggestion box. So is like an email that people can how does that work?
So it goes to our chief compliance officer. That person has access to, so I think it's on Google. So I don't know, but I'll get back to you and let you know that. But it goes to the chief compliance officer. Chief compliance officer will share them with the senior management, and then we'll have a discussion in senior management meeting. You know, here's the question. What's our response? Formulate a response, and then again, either it goes in a newsletter or it goes directly back to that employee. But it's active year-round, 365 days of the year, and it's constantly being monitored. So if there's something in there that needs an immediate response, we're able to do that. Typically, it's about 30 days if it's something that isn't, you know, a major issue.
There was
Just
also,
I was going to say one more thing about the staff surveys, because we do annual staff surveys also, and have made a lot of programmatic changes from feedback that comes from those. And this year, it was delayed due to COVID, and then we actually added in some specific COVID-related questions so we could really see across the agency what really worked for folks, what do we need to change, what do we need to keep doing. So we just wrapped those up. So it'll be interesting to have that feedback in addition to like our full survey that we usually do.
so there was a question that I saw in the chat about how one, specifically people funded incentives, particularly the overtime or differential. So how do people fund that?
Before you get to that, I mean, I want to say that we're unfortunately one of the agencies that didn't have the opportunity and luxury to be able to add in that differential. And so one of the things that I've been pushing is, again, alternatives and ways to be able to still put money in people's pockets. And one of those things is to actually be able to host around, a little bit prior to Thanksgiving, sort of an award ceremony virtually, so that we can still honor and give out monetary gifts to those who really made an extra effort. And I mean, we came to a place where like our restaurant is really leading the way in providing funding for our staff versus grants. And so we lost restaurants and they haven't come back yet. And so we're in a different situation. So I saw that in the chat. Also wanted to say that each organization is going to have a different kind of framework. And so there is and was no one size fits all. And that doesn't mean one is wrong or one is right. But I do agree that is the best way, right, is to raise salaries, put things in, but not every organization would have that opportunity.
So we took a leap of faith. The reality is that the city wasn't committed to reimbursing us for incentives. The state has never made a commitment to reimburse us for incentives. We have city contracts, we have state contracts. We solicited private dollars. We pushed very hard on the advocacy front with the city and the state. So when the city initially came out with a plan to provide it, it was a very narrow group of employees. I got on the phone and started sending emails to the mayor's office of contracts almost immediately, really pressing them around the fact that our security staff, our maintenance staff are absolutely essential to those programs and they deserve that incentive pay, and really pressing them on that. We also applied for the PPP and got a PPP award. So it's really about, and then at the end of the day, sort of realizing that worst comes to worst, I would go to my board and I would ask my board to fund it. No cannot be an answer. It really frustrated me to listen to the governor talk about how heroic these staff were and how they're deserving, and then putting the onus on the federal government to provide the funding to pay it. They work for us. They work for the citizens of the city of New York and the state of New York, and we have an obligation to take care of it. So we took a leap of faith, and we're okay. But we didn't sort of get the money and then pay it. We made a decision that we needed to do it. And then we said, our job as senior managers and as board is to figure out how to make it happen.
Yeah, I mean, I think some people are still waiting to get their reimbursement, but and
so are we.
Maybe they will, maybe they won't. But it was something we had to do. I mean, I think as we are getting ready to move into wave 2, we're going to be thinking about how to creatively do that the second time. Raihana, there was a question in there specifically for you about the childcare issue. Was it support for staff or was it support for residents? And what did you do?
Well, it was support for staff for the childcare stipends, so that those who were impacted because their children were not in school or couldn't go to childcare could still come to work if they needed to do so. And in regards to the residents, some of the things that we did because schools were closed is we had our youth teams. They created tutoring programs to help with that, with the shift to remote learning. Parents now became teachers and a lot of our parents struggled with that. And so we had our teams kind of going in there. We couldn't run our normal youth programming the way we did because of the pandemic. So they pivoted as well and offered in-person supports to the families for those children and creating safe spaces, for those who couldn't do it on their own for staff to be able to support them.
There was a question in the box in the chat about how people began to create their DEI or racial justice committees. How did people start that? Anyone want to?
Well, we formed ours a couple of years ago, and at first, like I said, I think we gave out a description of it, like what was the mission of it, a statement about it, and gave it out to all the staff, and had people who were interested apply, have the directors talk with all the staff about it, and then we really wanted to have at least one representative from each program, different levels of staff. So that's sort of how then but then we still needed to limit it to a reasonable amount. I think there's 30 maybe people on the committee. We have that many programs. So that's sort of how we started. And like I said before, we had the retreat then to really, because you have staff at very senior levels, case manager levels, all different levels, to really help create a space where everyone's voice is going to be heard and people felt comfortable with each other and got to know each other on these more deep levels, understand each other's cultural and background differences. And then the committee was meeting monthly, and now it's back on track. It took a 2 or 3 month pause from the beginning of COVID, and now it's back on track.
And for us, it's a relatively new experience. Ask for volunteers. Again, initially it came as a result of being asked whether or not Urban Pathway was going to post a statement on our website in response to support for Black Lives Matter. And, my response to that was that we got to do some work internally as an organization, because again, it's more than just making a public statement. It's about what are we willing to do as an organization to evaluate where we are, what our challenges are, and addressing those. So I'm chairing it for now. We have about 12 people who have volunteered to serve on it. We are going through a process of doing some reading. We are engaging a consultant to help us go through the Undoing Racism sort of experience, the 2.5 day, to develop our understanding of the issue. And it's a cross-section of staff. We may add a few additional people to the process, but again, I really want it to be a working group. It's not just to have a conversation about, race and racism. It's really looking at policies and procedures in the organization. So one of the things we realize is that a lot of the nonprofits, I've been doing this work for 40 years. And the paraprofessional staff typically get less vacation time than the professional staff. Well, why is that? And who are they? So we basically said no longer. If you're a maintenance worker, you get the same 4 weeks vacation when you start as a case manager. And sort of looking at things like that it was an opportunity to begin looking at the organization and challenging some of the processes that just have carried over from generation to generation that exist within the organization that disproportionately impact people of color, and beginning to address that.
One of the things that for us, right? So obviously, and not just where I currently am, where I'm the CEO, but realizing that work from home was a very elitist concept, right? So obviously senior level exec staff could just do it at a drop of a hat, right? Whatever, I could just do this. And then everybody else had to submit complicated work plans and what are you going to be doing and all of this stuff. And then, COVID hit and everybody who could partly, who didn't actually have to be at the desk or was doing operations, was suddenly working from home quite efficiently, quite effectively, and for the most part, people were, doing their jobs without any kind of monitoring and pre-scheduled things that had to be approved by their supervisor and stuff. And so I do think there are a lot of ways in which, the equity within agencies, we really should be looking at it and looking at ways to be more equitable. How are people, just a little bit of and I'm thinking about supporting staff as people are in kind of this weird daycare, child care space themselves, and our staff, how are people addressing that? Because I think that that's an ongoing issue, right? We thought it was going to be short term last semester, and now it's rolling into the fall.
Yeah, that's one of the things that we are actively working on right now. So our child care subsidy is ending. So we also had something in place. And one of the things we did was just opened up our sick days, where people may have more of those, to be able to not, you can use them as personal days now. So you don't need that note. It won't be scrutinized as much, to try to give a little bit extra time. Obviously, we're still looking for more emergency sort of COVID days, emergency sick days from the government, to be able to provide additional ones as well. And I think if we have to, because we're monitoring people's time, and I think that's the real issue is, we don't know how long this is going to go, but people are using a lot of their time up, and we may have to begin to subsidize in that area as well.
And we provided flexibility for those employees who are working a combination of off-site and on-site, so that they could coordinate their off-site days with the days that their children are home working remotely. However, we haven't figured it out for the folks who have to be on site. So if you're doing maintenance, you can't do that remotely. And if you don't have school. So I know that the city opened up a couple of centers. Some of our staff have utilized those resources, but it's really a challenge. It's really difficult for them to manage both their childcare and the desire to continue to provide income to their family through their employment.
We also just had somebody post in the chat that, working from home for some people is really difficult, right? Because, they're not in a nice little office corner, quiet by themselves. They're home with their children, with their partner, with, whoever else is there. So even sometimes the ability to work from home, including me sometimes, let me just go into the office because I could think better there. So we also have to acknowledge that. So I want to ask, we did some things to ramped up real quickly to, the first 30 days, everybody was frantic and frenetic. And we're probably, if you look at the city, rolling into wave 2. Let's ignore our president and let's listen to the experts and assume that this is where we're going to be. Is there any lesson or something that somebody did in wave 1 that they're really proud of and will continue to do regardless of COVID? And then I guess the second part of that would be, is there something that you are doing now just to prep for wave 2?
Well, we'll probably continue to integrate some remote work from home into the future of the organization, even after COVID. I think it just creates some additional options for employees, and there isn't really a major downside to doing that in some cases. So I think that that's something that we will continue.
Yes.
That model of the flexible scheduling, having that ability for people to, make the schedule that works best for them and their families, and having that remote and creating the spaces for people to feel safe when they're coming into the office, and just looking at what social services can be moving into the future. We might not always have to be in the office, and this kind of forced us to kind of reevaluate the way we run our organizations and the way, the expectations of our staff and how we perform.
Yeah, just echo what Fred and Raihana just said, the same thing about, thinking that in the past, like certain positions couldn't do remote, and realizing they can do remote and be really effective, and continuing in that way and rethinking, like, in that remote work, I think is now going to be a part of the ongoing work at our organization. And also, like, even when we resume, besides the client work, going back to meetings, like, do people have to travel an hour to the main office for a meeting, taking, and now can we do, more meetings virtually, even whenever that might be that you could go back to meetings? Is that really necessary? And we realize you can get a lot of value out of having a Zoom meeting as opposed to wasting 2 hours of travel time and, the burden of that. So it's another.
I miss my travel time. For the break, read it. Mark, you look like you were going to say something.
Yeah, I mean, those meetings is where I was going, you know, just to get in that. But also, and shout out to our social workers. So I know I saw one in the chat, Anna, hello. And I mean, they've been actually doing a lot of electronic form assessments. And so what that's allowed us to do is really get the data really quickly. So who needs food? Early on, they were looking at who needs food, who needs help with shopping, who needs help with whatever it was, who has a disability where you can't do this. And that allowed us to be able to, you know, outside of the office, access that information and really be data driven. They're doing that now with COVID testing, and we're going to be able to bring in some folks to do on-site COVID testing, because they know now that 70% of the building wants that from their electronic assessment. So that's something we were not doing before that we added in that we probably will keep.
And something that has not yet been said that I want to make sure I mention at least is the fact that part of supporting our staff was also supporting our clients and making sure that we were providing them with good, clear communication. So one of the other things that we've been doing throughout the pandemic is daily communications to our clients through a newsletter that initially it was all about COVID, but more recently it's been about census, it's been about voting, it's been about access to you know, mental health services, all kinds of content. But the idea of making sure that they understand sort of what's going on, what's available to them, how the pandemic is impacting them was also important. That reduces some of the anxiety within our residential programs, which also benefits, makes it easier for our staff to do their work.
So
Sorry.
one person just posted that, you know, kind of the digital, if we could address the digital divide for our clients, then remote probably becomes a greater possibility. And then there's one other question that how did COVID impact interpersonal relationships among staff? And do you actually feel that the pandemic might have broken down some barriers between levels, staff levels, management and direct care staff?
I do think the pandemic broke down a lot of those levels. You had more platforms where you were interfacing with people at all levels more often, where before you didn't do that. I also think because it forced everyone to stop, you really had to sit still. I think we, especially as social service providers, are just so used to going, right? We're doing, and the pandemic caused the world to stop and sit still for a minute and kind of reevaluate things. I think it helped us to create more balance in our lives. Work-life balance became really important when we talked about wellness committees, right? When we talk about compassion fatigue, and everybody was in it, and it gave you a chance to really start to put things in perspective for your life, and then even in your workspace. And you're realizing, you're noticing people now more, right? Your colleagues are not just your colleagues, but you're having different types of conversations, and you know, you commiserate on things that are going on. So I think it did break down those walls, and it caused more, you know, people to come together.
So one of the things that I had heard is that for existing clients or tenants or residents, you know, maintaining that relationship was okay because we already had a strong relationship. Anybody talk about what new intakes was like when you are developing a relationship that is like remotely? Was that different? Because I do think that with our existing relationships, we already had a relationship. So whether we called you up or whether we Zoomed you or whether we knocked on your door once every whatever, I think that was okay. But one of the things I had heard is that for new people, kind of both staff and clients, it was challenging. So how, anyone talk a little bit about how they might have addressed that?
I think one of the things for us was really getting away from the quote unquote my client and really starting to see more of a collective that we're working together. And so if I'm off site, I might need your help to go visit this room or that room or to go to this place so that, you know, if I'm normally or prior, this idea that if I'm not here, no one else can work with that person. So breaking down those walls, I think really helped us to work more cohesively and help the tenants when they're moving in or other things to feel like there's a team here that I can go to, not just one particular person.
Yeah, at the beginning we were doing all like the new move-ins just like virtually, on the phone because it wasn't considered essential. And we realized, like what you said, Jeannette, it wasn't making that connection. So now the on-site team, regardless if they're the worker, meets with the person that day to sort of get at least some of like that face-to-face time, help them to see around the program and the building. And in terms of onboarding new staff, that has been something we've been talking about internally as a big challenge. And we just actually had a meeting across all our program directors, like a sharing ideas meeting about like the onboarding and like what's working, sort of what's challenging. I don't have all the answers, we're figuring it out, but how to get, also just understanding the agency culture. How do we work with our clients? How do you connect as a team when you're not like meeting with the team? So it's, yeah, so, I think like using Zoom, setting up meetings with the staff, with other staff in informal ways, because they're not getting any of that informal stuff, doing some like informal lunches to help, Zoom lunches to help them, besides all that formal like supervision that you're having. It's, yeah, so we're gathering all these like creative ways that staff have been doing that across our sites and like sharing that internally, because I think it is going to be for a while, because we're still on these remote shifts.
Well, believe it or not, we are at 1:59. Any last words, suggestions, comments?
Just that we need to make a commitment to continue supporting our staff post-COVID. This needs to be an ongoing process. I think for us, I think it elevated how essential our essential employees are. And they're not just essential because there's a pandemic. They're essential because we can't do this work without them. And the clients don't get better and sort of advance without them. So they are key, and we need to keep that in mind.
And take care of each other. Just take care of each other.
Yeah.
And I would say continue to share across the board. I mean, I've been able to learn from all of your organizations, and I want to thank Shinny for, their job of bringing us together and allowing us to learn from one another, because we are not islands unto ourselves.
Yes.
Ever have my advocacy dues gotten me so much?
Absolutely.
Adina?
Yeah, I would agree. And I, like learning from our staff, learning from other organizations, the Shinny Reopening Committee I was a part of, it was really helpful in hearing what other people were doing and integrating it. And just in continuing to support our staff and the really amazing work they do every day. I've been always very impressed.
So there was a question about whether or not, I think that this will be is being recorded and will be available on the Shinny website. So somebody wanted to know if it would be available. All right, so I just want to thank everybody for my panel and certainly for my 170 something participants. Wow. Thank you everybody for logging in today. We really appreciate it.